Your dog's muzzle is going gray. Maybe it happened slowly. You didn't notice until one morning the light caught it a certain way, and you thought, when did that happen? They're a little slower on the stairs now. They sleep more. And somewhere in the back of your mind, a clock starts ticking. I've watched that clock start for thousands of owners across 22 years of veterinary medicine. And what I want to tell you today, what I need you to hear before anything else, is this. Growing old isn't the enemy. Growing old without a plan is. I want to tell you about a dog named Rosie. She was a 9-year-old chocolate Labrador, and her owner, a woman named Patricia, brought her in for what she thought was a routine checkup. Patricia was one of those owners I genuinely admired. Never missed an annual visit, quality food, regular walks, real love for that dog. But when the blood work came back, I found early kidney changes, mild cognitive markers, and a joint inflammation score that told me Rosie had probably been uncomfortable for at least a year without Patricia ever knowing. Not because Patricia was neglectful, because Rosie was stoic the way labs are, and because nobody had ever told Patricia what to look for, what to adjust, or what a senior dog actually needs that a younger dog doesn't. She seemed fine, Patricia told me. And that's the thing. They almost always seem fine, right up until they don't. I want to make sure you never sit across a desk from someone like me hearing those words for the first time. By the end of what I'm about to share, you'll have an actual plan. Not a vague list of intentions, a real plan with specific steps you can start tonight. But first, I need you to understand something that most owners never get told. Because the mistake I see most often isn't cruelty or neglect. It's applying the logic of a young dog to an old one. Think about what happens to a car engine at 150,000 miles. The oil still circulates, the pistons still fire. But the tolerances have tightened, the seals have worn a little, and small inefficiencies that meant nothing at 20,000 miles now compound into real problems fast. Your senior dog's body is running the same engine, but the maintenance requirements have changed completely, and most owners are still following the manual from when the car was new. Here's what's actually happening inside your dog as they age. Their metabolism slows, which means the same food that kept a 3-year-old lean starts depositing fat around the organs of a 10-year-old. Their kidneys filter less efficiently. Think of kidneys like a coffee filter that's been used 1,000 times. It still works, but it's working harder for a worse result. Their joint cartilage thins out, and the synovial fluid that lubricates those joints produces less of itself. Walking upstairs isn't just slower, it hurts. Their immune system, which once responded to threats like a well-staffed emergency room, now runs more like a small urgent care clinic. Capable, but slower and more likely to miss things. And then there's something most owners have never heard of, and something I'll get into in detail in a few minutes that I think is going to genuinely surprise you: canine cognitive dysfunction, the dog equivalent of early dementia. And the early signs are things most owners are already seeing and dismissing as just getting old. Your vet isn't keeping any of this from you. They have 7 minutes with your dog during an annual exam, and they're doing everything they can in that time. What I'm giving you today is the 20 minutes your vet wished they had. I've spent 22 years as a veterinary internal medicine specialist. I've opened up bodies to find damage that had been building silently for months, sometimes years. I've held animals in their last moments when the outcome could have been different. Every single time, I ask myself the same question: how did it get this far? The answer isn't always dramatic. Most of the time, it's quiet. Nobody told the owner what to watch for. Nobody handed them a plan. That's what this is. So, the plan. The first thing I want you to do is reframe exercise entirely. Not eliminate it, reframe it. I've had owners come in who stopped walking their arthritic dog because they thought movement caused the pain. I understand that instinct. You see your dog limping, you want to protect them. But controlled, low-impact movement is one of the most powerful anti-inflammatory tools we have in veterinary medicine, and stopping it is one of the worst things you can do for a dog in pain. When your dog moves, the synovial fluid in their joints gets distributed across the cartilage. Think of it like shaking a snow globe to keep the snow from settling at the bottom. When they stop moving, the fluid stagnates, the joints stiffen further, and the muscle mass that supports those joints wastes away, which puts even more pressure on cartilage that's already thinning. What this looks like in practice: shorter walks, more often, 20 minutes twice a day beats 45 minutes once, flat terrain over hills whenever you can manage it, grass and dirt over pavement, swimming, if your dog will tolerate water, is close to perfect, full range of motion, zero joint impact. I had a 13-year-old golden retriever named Arthur, whose owner started water therapy twice a week at a local canine rehabilitation center. 6 weeks later, Arthur was climbing into the car on his own again for the first time in 8 months. His owner cried in my exam room telling me that. Have you noticed your dog hesitating before stairs? Or pausing before jumping onto the couch they used to leap onto without a thought? Tell me in the comments. I want to know how many of you are already watching this happen. Now, and this is where I want you to pay close attention, because what I'm about to tell you is something most owners don't connect to joint pain at all. Movement alone isn't enough if the inflammation inside that joint is outrunning the body's ability to repair it. Omega-3 fatty acids, specifically EPA and DHA, the forms found in fish oil, have more clinical evidence behind them for joint and cognitive health in dogs than almost any other supplement on the market. EPA and DHA work by interrupting inflammatory signals at the cellular level, like turning down the volume on a fire alarm that's stuck going off inside the joint. The research on DHA specifically is something I find genuinely compelling. It's one of the primary structural components of brain cell membranes, and in aging dogs, adequate DHA levels correlate with measurably slower cognitive decline. Not stopped, slowed. That distinction matters, and I'll come back to it when we talk about what's happening in your dog's brain. The dose matters. I want to be precise because a fish oil capsule means nothing without context. For a dog under 25 pounds, 500 to 1,000 milligrams of combined EPA and DHA per day. For a dog between 25 and 50 pounds, 1,000 to 2,000 milligrams. For a dog over 50 pounds, 2,000 to 3,000 milligrams. Always buy from a brand that publishes a certificate of analysis. That means a third party has independently tested the product for purity and verified the actual EPA and DHA content matches what's printed on the label. Most dogs take the capsule on top of their food without a second thought. I had a 10-year-old border collie mix named Stella. Sharp dog, sharp mind starting to dull around the edges. Her owner noticed she'd started getting lost in the backyard at night, walking to a corner of the fence and just standing there. 3 months on a quality fish oil supplement at the correct dose, combined with the cognitive work I'll walk you through in a moment, and the nighttime episodes dropped from 5 or 6 times a week to once or twice a month. Not eliminated. I want to be honest with you, but her owner said something I've thought about since. I feel like I got some of her back. That's what we're after. Now, let's talk about the brain. And I want you to stay with me here because this section contains something I think is going to reframe how you've been reading your dog's behavior. Canine cognitive dysfunction is the dog equivalent of early-stage dementia, and it affects an estimated 28% of dogs between 11 and 12 years old, rising to over 68% in dogs older than 15. Those numbers come from published research. I'm not speculating. But here's what I want you to know. The early signs are almost never dramatic. They look like this. Your dog stares at a wall for a few seconds and then walks away. They walk into a room and seem confused about why they're there. They greet you at the door and then immediately wander off like they forgot you just arrived. They sleep more during the day but seem restless at night. You looked at those things and thought, they're just getting old. And maybe you were right, but maybe you were watching the beginning of something that moves faster without intervention. Does any of that sound familiar? I'm asking seriously. Think about the last 2 weeks. The brain is plastic, meaning it physically changes in response to stimulation at any age, but it requires actual stimulation to maintain that plasticity. A dog whose world shrinks as they age loses neural connections faster. The answer isn't complicated or expensive. A snuffle mat, A rubber mat with hundreds of fabric strips where you hide kibble turns a 2-minute meal into a 15-minute nose-led foraging session. The olfactory system, the part of the brain that processes smell, is one of the last systems to deteriorate in aging dogs, and activating it fires more neural pathways than almost anything else you can do with $5. Puzzle feeders, treats hidden in paper bags around the house before dinner, teaching one new simple cue per month. Not because your senior dog needs new tricks, but because the process of learning requires the brain to build new connections. And new connections are exactly what slows the decline. I prescribe this as seriously as I prescribe medication. That's not a metaphor. I want to mention diet, and I want to do it quickly because I know change your dog's food sounds like a larger lift than it is. When your dog crosses into senior territory, generally 7 years old, earlier for large breeds, a few things need to change that most commercial senior foods don't actually address. Fewer calories, adjusted for the slower metabolism, or you're building toward obesity, which accelerates every other problem we've discussed. Higher quality protein, not less protein. There's an outdated idea that aging kidneys need a low-protein diet, and for dogs without existing kidney disease, current research doesn't support that. What aging kidneys actually need is less phosphorus, which is a different thing entirely. More antioxidants, vitamins E and C, selenium, because the aging immune system generates more oxidative stress, which is like internal rust accumulating on the machinery faster than it used to. And moisture. Many senior dogs drink less water than they need, and the simplest fix I know is adding warm water or low-sodium broth to their kibble once a day until the bowl looks like a thick soup. Cheap, immediate, and their kidneys will show the difference on a blood work panel within months. I had a 12-year-old beagle named Gus, whose owner made exactly that one change, warm broth over kibble daily, as part of a broader senior plan. At Gus's next blood work 6 months later, his kidney values had stabilized after 2 years of slow creep in the wrong direction. His vet, not me, his regular vet, called his owner to say she wasn't sure what had changed, but something clearly had. His owner knew. Check your current food's ingredient list right now, not next week. What's the first ingredient? If it's something you can't picture as a real food, that's information worth acting on. Tell me in the comments what you find. I read every single one. There's one more thing, and I've saved it for last deliberately because it's the one most owners resist the hardest. Dental health, I know how that sounds, but I need you to hear me on this because it is not what you think it is. I've operated on dogs whose oral bacteria had been traveling from infected gum tissue into the bloodstream for years, seeding the heart valves, the kidneys, the liver with low-grade bacterial infection. Periodontal disease in dogs is not a cosmetic problem. It is a slow, systemic infection that drains immune resources your senior dog cannot afford to spend. Gum tissue works like the seal around a bathtub drain. When it's intact, it keeps bacteria locked out. When it deteriorates, everything below is exposed. And in senior dogs, that immune system is already running leaner than it was 5 years ago. A chronic bacterial drain on top of that is a weight the body eventually stops carrying well. Daily toothbrushing with a dog-specific toothpaste is the gold standard. If your dog won't tolerate brushing, and many won't, enzymatic dental chews used daily are a credible alternative. Not the starchy biscuit kind, specifically enzymatic. A professional cleaning under anesthesia once a year or as your vet recommends is not optional for most senior dogs. I've heard the anesthesia concern many times. The truth is that modern veterinary anesthesia protocols for senior dogs are extremely safe when managed properly, and the risk of untreated periodontal disease compounding over 2 or 3 more years is far greater than the risk of a single well-managed dental procedure. I've seen what that trade-off looks like when owners choose wrong. It's not a fair comparison, and binding all of it together, every single thing I've told you today, is one structural change that most owners don't make until something goes wrong. Seeing your vet every 6 months instead of every 12. I want to say that differently. Not as a policy, as a fact about time. A year in a senior dog's life is not a year in your life. The physiological changes that take 3 years in a young adult dog can happen in 12 months in a senior one. Blood work every 6 months catches kidney changes when we can still intervene, not when we're managing decline. It catches thyroid imbalances that look exactly like normal aging but aren't, and that are entirely treatable when found early. It catches pain scores that your stoic dog, your lab, your shepherd, your beagle who never complains, was never going to communicate to you on their own. The visit isn't what you should be afraid of. What you should be afraid of is the year between visits and what moved silently inside your dog while you were waiting. Here's what I want you to see about everything I've shared today, not as a list, as one idea. The exercise keeps the joints moving and the muscles strong. The fish oil turns down the inflammation the joints and brain are generating. The cognitive enrichment uses the nose, the last neurological system to go, to keep the brain building instead of retreating. The diet shift takes pressure off kidneys already working harder than they were and gives the immune system cleaner fuel. The dental care removes the bacterial drain that was quietly taxing a system your senior dog needs for everything else. The 6-month vet visit is the early warning system that catches what you can't see and what your dog won't tell you. These aren't separate recommendations. They're one argument. Your senior dog's body is fighting on multiple fronts simultaneously, and each of these things reduces the load on one of those fronts. Lighter load across all of them. That's the room all the doors lead to. Rosie came back 6 months after that first appointment. Patricia had done everything. Adjusted the walks, started fish oil at the right dose, switched to a senior-appropriate diet with broth added, scheduled the dental cleaning she'd been putting off for 2 years, and moved to every 6 months visits. Rosie's kidney markers had stabilized. Her joint inflammation score had dropped. Patricia pulled out her phone in the exam room and showed me a video of Rosie doing something she hadn't done in over a year, chasing a ball in the backyard, slow and stiff, and clearly not the dog she used to be, but doing it. Tail going, ears up. Rosie, still in the game. "Why didn't anyone tell me this sooner?" Patricia asked. I didn't have a great answer, except that this is exactly why I make these videos. Your dog has been with you through everything, through the hard years and the ordinary Tuesdays that turned out to be the ones you remember. They never asked for anything elaborate, just to be near you and to keep going a little longer. A graying muzzle isn't a countdown. It's an invitation to be more intentional than you've been. Pick one thing: the fish oil tonight, the broth on the kibble, the call to your vet tomorrow to move to every 6 months. One thing. That's all it takes to start. If someone you know has a senior dog and you think they need to hear this, send them this video. Not for me, for Rosie, for the next dog who gets the chance she got because somebody cared enough to share what they learned. Everything I've shared today is general information based on current veterinary research and my clinical experience. It is not a replacement for your individual pet's veterinary care. Please speak with your vet before changing your dog's diet or starting any supplement, especially if your pet has existing health conditions. Your vet is your partner in this, and the most important appointment you can make is the one that's overdue.